You need to have the right people at the table because you have to have a shared value and a shared vision. Without that, you're not going to get the job done.
This is where it all begins, so say goodbye to all your fears, all your doubts. This is where they die. This is where we come to win, we come to fly. This is where we make our dreams come to life. Welcome to Innovation City.
Welcome to Innovation City, a podcast featuring the innovators, disruptors, and creators who are making things happen today. My name is Michael T. Johnson. I'm here with my co-host Tyler Kelly, and we are at Venture Cafe Miami. Venture Cafe is the #1 largest gathering of entrepreneurs, creatives, disruptors who are making things happen, the largest gathering in the world anywhere. So we're very excited to be in Miami tonight, and we're also very excited to have Janisse Schoepp with us. Janisse, thank you for being here.
Thank you so much.
So for those of you who are wondering about Janisse has been an integral part of strategic planning, program development, research, and evaluation at the Health Foundation of South Florida. She's the Vice President of Operations and Strategy. She has a master's in public health, Ph.D. Currently, you just got back from the Harvard Business School's Young American Leaders Program, and you were also selected as a fellow for the Terrence Keenan Institute for Emerging Leaders for Health Philanthropy. And you're doing some amazing things here in South Florida. And
I hope
we're
so.
excited
There's a lot to be done.
to talk to you about all that. Welcome to the show.
Thank you so much.
Now, Janisse, tell us how you got started in what it is you do. Like, take us back to the inspiration.
The beginning.
The beginning.
Oh, the beginning. So I am originally from Puerto Rico and had no clue what I wanted to do. I started in engineering, and by the third year, thermodynamics really scared me. So changed my educational goals at that point in time. Thought I was going to go into med school, but pretty much got into a public health program, which I knew nothing about what public health meant at the time. And, from there came to Miami for my graduate studies, did them at Florida International University, which is the largest Hispanic public research university we have in the country. And it's been kind of, love at first sight since then.
So tell us, what does public health mean?
So public health is really focused on population health. So while the medical field is focused on treating the individuals when they get sick and so forth, public health is really looking at how we can improve the health of the population, of communities, and not necessarily when they're sick. We're trying to prevent them from getting sick. And I think the field itself has evolved over time, where perhaps in the past we were educating people how to eat healthy, you need to exercise, but we know that we can't be teaching people these types of healthy behaviors if they live in communities where they can't exercise that, right? Because of crime or concerns with safety, because there's no grocery stores to buy healthy foods. And so a lot of the focus really now is around community health and how we can create a built environment that will support a quality of life for its residents.
So much more proactive than
it's a proactive
an individual health approach.
Yeah, absolutely.
And so what are some of the things that you're looking at? So like the grocery store issue is a big one, right? Mm-hmm. But you mentioned like areas where you might not want to go outside and exercise. Is
correct. Yeah. So we have a lot of communities where we see health disparities. And so, we know this. It's like our minority communities, those that are largely Hispanic or African American, we see higher rates of diabetes or hypertension, high cholesterol, and so forth. And yes, it's important to go to your primary care doctor and, get yourself your annual checkup. But they're also in communities that perhaps lack open space, parks, after-school programming. Perhaps they don't have this concept of complete streets where even sidewalks are not part of their neighborhood. Going back to, access to healthy foods, there's no grocery stores, so they depend on the corner stores, which typically have, less or limited access to fresh fruits and vegetables, and just don't have the variety in terms of whole wheat and, low-fat milk, etc. And so we're really looking at the Health Foundation, which is where I've been for the last 14 years, how we can create a culture of health within these communities and change the environment, the policies, and the systems that are in these communities so that people can actually exercise the behaviors that we've been trying to teach them all along, right?
Yeah. Yeah. So you mentioned a lot of specific things, but what's like kind of the biggest factors, systematic factors that are affecting people's health right now?
So the big buzzword right now is social and economic factors of health, social determinants of health. And it's said that 40% of whether people have access to jobs, poverty status, education, access to primary care and transportation is what's driving poor health in this country. So that's 40%. That's followed closely by healthy behaviors. So whether people, again, are eating healthy and whatnot, but as I said, it's a result for many individuals of their environment. So there you have 70% already. Genetics you can't do anything about, right? Which is around 10 to 15%. So we're really focused, again, around these community factors. I mean, for the Health Foundation, and I don't know how much you know about foundations overall, but we have been for a very long time focused on, okay, let's increase the quality of the clinical space, right? How services are being provided to individuals, working with hospitals, primary care centers, and so forth. We've been now recently shifting more towards working with community and economic development, which part of that is like our banks, our financial sector, which have Community Reinvestment Act regulations where they have to invest in low to moderate income communities. And so it's like, how do we make sure that the infrastructure investments that are being made by this sector are tied to the health outcomes that we're trying to change?
Yeah, because I'm assuming what you're saying
That's a lot of the innovation now.
Yeah. Mm-hmm. I'm assuming is what you're saying is that economic investment helps people have access to all those factors, and then
right,
quality of health goes up in communities.
Right.
You probably have, like, as your organization, you've got like this mission, this thing you're trying to accomplish, but you've probably got kind of this personal thing that drives you as well. Obviously, when you're part of an organization, those things cross. Otherwise, you wouldn't feel like you have a purpose in your job.
That's right.
But so tell me about what drives you.
Right. So I consider myself very fortunate, right? Because not a lot of people get to do what they love every day. What drives me, as a mother, is really making sure that especially our children have access to the opportunities that they deserve to be able to be, productive, healthy citizens. And so I work for an organization. So it's basically like I have money that obviously in my personal life I don't have, but I work for an organization that can make the investments in our community that can actually make a difference in people's lives. So that's what drives me. I mean, I enjoy what I do. I have a soft spot for children. And I think that we need to make sure that everyone has equitable access to the opportunities, whether that be education, starting early at the early stages, so early high quality education, and all throughout, whatever else is what the neighborhood, looks like, access to after school programming and so forth.
And there's a ton of redevelopment happening. Are you guys involved in like those community plans and those types of things to make sure that happens?
So redevelopment is an interesting phenomena, right? Because it's good for communities. What's happening here in Miami, and that's part of what we're trying to, I guess, understand along with some of our other community partners, is that an unintended consequence of that redevelopment is gentrification. And so where the Health Foundation is trying to insert itself in the process and in the conversation is how do we make sure that when you're redeveloping a community that you're preserving affordable housing, that you're not pushing out the people that have been residents there for many years, and even doing health impact assessments, which is a process by which any redevelopment project, you know how they do environmental impact assessments for any development project. So there's one that's focused on health. So like, what would be the impact of, a project, whether that be transit related or not, on the health of that community. And so, we're at the early stages at the national level, and then for us as a local regional foundation, we're at the very early stages of seeing how these two sectors interconnect and how they can work together. It's the very first time that's happening, right? And these are very new relationships that are being established and nurtured.
That's awesome. When I think of Miami, what I've seen is that, there's clear examples on the West Coast where it didn't work out the way that we would like it to. But I think Miami is like the difference maker in that respect. So it's good to hear that those relationships are early and developing, and there's conversations happening. I mean, that's better than
we're a new city, right?
Yeah.
So we're a new city, and I think that we're a melting pot. We're probably what America will look like in the future. And I think that if we get this right, we can inform other cities. But it's disruptive, right?
Mm-hmm.
Because right now, there's a lot of leadership and cultures that need to be, and relationships that kind of need to be made. And, there's a new space for this conversation to happen. And I think that takes time. There's trust building as well. There's a lot of opportunity, especially within this city. And if we get it right, I think it's going to be a model for the rest of the nation.
That's huge.
So you talked about those conversations, I'm assuming, not being the norm with large scale development and the impact. But as you see these things start to happen, what are you excited about?
Excited about the possibility, right? So we have, I would say that one of the prime examples that comes to mind, and we weren't part of that, but I think it just speaks to what's possible, is Liberty City Square. And so here you have a large housing developer who's doing an affordable housing development project with wraparound services. So co-locating not just the housing with a health center, early education, job training, and all of these other, supportive services for the residents. And so I think that's kind of, we know millennials want to live in the city. They are moving back from suburbs. We're a very car-dependent community. And so how do we develop in a way that's catering for the young families that want to stay here, and also, addressing the needs of those, because I'm not sure where we are right now, but we're like the third poorest city in the nation. We were one at the top of the list at some point. I'm not sure where we are, but I know we're at the top. That's city of Miami, and we have all of these different neighborhoods that are very ethnic rich, right? So we have Little Haiti, Liberty City, Little Havana, which is being gentrified rapidly, Coconut Grove. So I think we have to come up with a solution that addresses the needs of those that have been there for a very long time. And these types of projects, like the one in Liberty Square, is a prime example of that. So I think I'm excited about just the fact that we're kind of coming together collectively to think about what's possible. Health has typically not been part of the conversations in the past when you're thinking about zoning or urban planning or whatnot. So again, it takes time and proactiveness, I think, from our part to be inserted in those conversations. But I think that's the opportunity and something that I'm excited about.
So what's the biggest challenge that obviously there's large scale challenges, and we've talked about a lot of them, but maybe for you personally, what's the biggest challenge that you face in accomplishing what you're trying to accomplish?
Day to day, yeah.
Yeah. So I would say that challenges are at two levels, right? So at the foundation itself, we we are also changing a culture internally. A lot of what we're talking about here is new, right? We're really moving towards a new way of how we do our business. So traditionally, foundations have always been seen as grant makers, for example. We provide a grant to a nonprofit, see you in 6 months or 12 months, you give me a report. Did you do well? No? Okay, great. Okay, see you later. We don't want to do that. We want to be true co-partners with our partners and co-develop solutions together. So that requires a different skill set internally from staff. It also requires a different culture because now we're moving away from just being a grant maker, but we want to provide technical assistance. We want to be conveners. We want to be more proactive in policy discussions and, just relationships with our elected officials. We want to shape the markets. And what I mean by that is our limited resources can't do the change that we're hoping to do, right? We're dealing with very complex factors that are social in nature, that go back to, structural racism, segregation, all of these things. Very complex. So our money will never move the needle, and that all ties to health, of course. So shaping the markets is basically saying, okay, how do we align with other funders in our community? How can we use our dollars perhaps in a way that can catalyze other investments? So unlocking other capital, private capital that's out there. And so it's like this public-private partnership, right, that we're all kind of, I think will be needed to address the issues that we're talking about. I think that there's a challenge in, compared to the past, and this is something that we discussed extensively at a recent leadership development program that I attended, is that private businesses in the past had a natural interest in their community, right? Manufacturing companies, whatever, they really invested in their local community. But with globalization and everything that's going on, they've kind of left their local community and not so interested in investing, right, in their educational system and so forth. How do we kind of drive that interest back, right? So that not just anchor institutions, which is something else that we're working on, our hospitals, our universities, but also our private businesses that are headquartered here. How can we tap into their interest and commitment to investing in this community to make it a better, thriving place? I think it behooves us if we lose that vision.
Is there anyone else or any other municipalities across the country that are ahead of the game on this, or is Miami really like paving the way?
So
or could potentially pave the way.
Right. So I think that so interestingly enough, I think that the answer to that is that we're probably looking at our own way of looking at this opportunity. We're told by others, I don't know, that we are ahead of the game. I think we have, like, for example, this anchor institution initiative that we have started at the Health Foundation. It's very young. It's in its infancy. It's an emerging field at the national level, but it's how to tap into the local economic power that these institutions have. They're our largest employers. Could they create workforce pipeline programs that link back to low to moderate income communities and create pathways for these individuals? Or how can they open up their procurement to small businesses, local small business, instead of, kind of centralizing everything at the national level or whatever, so that a lot of that investment stays local. I think it's fair to say that some of these institutions have been doing this elsewhere. We can learn from it, but here we're looking at it from how can we do it collectively and also engage the private sector. So by definition, anchors are like public institutions because they're here, like University of Miami and FIU. They're not going to close shop if the if there's an economic recession, right? So hence why the focus on public. And private companies, yes, they could close their doors and leave, but I think we have very long history of private businesses headquartered in Miami that are committed, and that's kind of different for us. And I think, it's an opportunity to create a model that fits our environment and our community. So we're a trailblazer. Yes, I would say
I love that. I mean, and I feel that.
Yeah, a lot of challenge. We're learning.
It's early, which is why
early.
It doesn't
Right.
seem like there's
Yeah.
progress, but there's a ton of progress being made. You can feel it in the air.
Yeah, awesome.
Yeah, we see that. I mean, we see that in Miami, and obviously, being from St. Louis, we see that cities that have their own unique problems also are on the front of solving those problems because they deal with issues that other cities don't have to deal with. So they get to be the trailblazers and
Yeah,
learn everything and then share all that with
Right.
the world. So
right.
So for people that are out there that want to, specifically just here in Miami, that want to help, how can people help?
Well, for one is like get engaged, and obviously the Health Foundation is always seeking new partnerships. You can call and ask for me or any other of my colleagues to get connected to the initiatives that we have going on. Sometimes it's about networks, and so I don't know everyone in this community, especially when it comes to other sectors that are non-health related. And partnerships go a long way. So introductions to businesses that perhaps might be interested in crafting, like I said, an innovative solution for the issues that we're seeing in our community. And that's what I would say. I mean, at least at this early stage, it's about engagement, partnership building, and making connections that are non-traditional, because that's what it's going to take. That's the disruptive part, right?
yeah. What major disruptions are you seeing? Like, are you seeing this kind of disruption happening and seeing some progress?
In Miami or elsewhere?
I think
Yeah.
all of the above.
Yeah. So, I think I'm going to, digress a little bit, because I think there's a lot of disruption, quote unquote, happening within the field of philanthropy and even hospitals across the nation that are betting on not just making use of their grant making, let's say, as a tool, so that would be on the foundation side, but creating these pooled funding models to address the social determinants of health, like affordable housing, right? So you have a hospital system saying we're going to put $200 million on a fund to attract other private capital to do an affordable housing development project, right? That's not what's happening here in our local community yet. That's what we want. That's where we want to go. I think for the foundation at the local level, we're fairly small. We have maybe roughly $140 million in assets, make about $5 million a year in grant making. But I think where we're focusing on is, okay, so how do we maximize that? Do we tap into our endowment and do impact investing, which is basically, yes, expecting a financial rate of return, but social impact is really the first lens by which you would make an investment. But it allows us to address some of these issues that are not going to be solved through a $50,000 grant, right? So we're investing and being a catalytic agent, hopefully trying to get more capital to the community to address, these issues. So I think that's, again, it's not happening currently here. And that's the challenge. It's not happening. So there's a lot of, one, education that you need to do of the potential partners that could be engaged in this work. And then how do you change that culture or those norms? That's not easy. It's not an easy task, even internally, right, for the foundation.
Yeah. Is there any other advice you give to someone? So, I mean, you're talking about partnerships, you're talking about collaboration, you're talking about fundraising. Like, these are all kind of complicated things. Yeah. Is there any advice you would give to anyone that's in any of those kind of areas?
Yeah, so Probably, I guess, in the way of lessons learned, the way that we have been talking about collaboration is to have cross-sector collaboration. And so, again, I think that that's what it will take to work across sectors to, improve health or whatever it is that that you're interested in. It's always going to be cross-sector collaboration. I think it's the way to go. But that means that you have to have a collective vision. So it's like you need to check out your egos. You need to have the right people at the table because you have to have a shared value and a shared vision. Without that, you're not going to get the job done. And so that's kind of the most challenging part when you have people from all these different sectors, organizations, day-to-day jobs that have to kind of, take their jacket off and say, okay, this is our community. What is it that we need to do to better this community? And how can I individually help, or how can my organization contribute to this particular mission or vision? And so, it takes time. It's trust building. I think that resident engagement is huge. It's not easy, but I think that, organizations need to trust community residents and make them part of the process. We cannot continue with a top-down approach where we think we know best and we're going to go into a community and we're going to solve all of your issues if we don't share that lived experience, right? So I think that we need to give a space for that voice to be part of the planning process, to be part of the decision-making process. And at the end of the day, these communities are the ones that stay behind, right? They're the residents. So by giving them ownership early on, I think you're also, something that funders are always concerned about is sustainability, right? What happens when we leave or our funding leaves? And so you need to build the capacity of whoever's staying behind, and you need to do leadership development, and you need to make sure that you are investing in that community in a way that they will continue the work moving forward.
Wow, this has been a pretty amazing conversation, I think.
Thank you.
I think Miami's fortunate to have you and the Health Foundation doing the work that you do. So thank you for that.
Thank you.
How can people get in touch with you or the foundation?
So our website is www.hfsf.org. My email is jschoepp@hfsf.org. All of the information is on our website. And, a call to the foundation, you can ask for me.
Awesome.
Yeah.
Well, thank you, Janisse.
Thank you.
Yeah, thank you for being here.
Thank you.
For more episodes, visit innovationcity.co. Be sure to subscribe, rate, and review. And if you're in Miami, visit us on Thursday nights. Details are at venturecafemiami.org. And be sure to connect with us on social at WeAreSlam and at Venture Cafe MIA. Thanks for listening.
This is where it all begins, so say goodbye to all your fears, all your doubts. This is where they die. This is where we come to win.